Welcome back to News 46. Colorectal cancer is the second leading cause of cancer death in the United States. Screening can accurately detect early-stage colorectal cancer and precancerous polyps. The U.S. Preventive Services Task Force, an independent group of medical professionals, continually reviews the latest information on a wide range of preventative services, including cancer screening. The task force has just issued updated recommendations on colorectal cancer screening for adults.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
In the United States this year, an estimated 134,000 people will be diagnosed with colorectal cancer, and about 49,000 will die from the disease.
Most colorectal cancer occurs after people are 50, and the rates go up as you get older.
Dr. Douglas Owens, an author of the recommendation and a former member of the U.S. Preventive Services Task Force, says the group strongly recommends screening average-risk adults age 50 to 75 for colorectal cancer, and then making individual screening decisions for adults age 76 to 85, taking into account the patient's overall health and screening history.
There are a number of ways to be screened for colorectal cancer, and the good news is that they are effective.
Those include direct visualization tests like a colonoscopy and also stool-based tests.
The important thing is that you choose one and be screened. For people 76 to 85, the benefits of screening are smaller, but some people may still benefit. People who've never been screened before and who are healthy enough to undergo treatment for colorectal cancer, should it be diagnosed, and who don't have other conditions that would limit their life expectancy.
The decision to screen for colorectal cancer in this older age group should be individualized and take that patient's overall health into account.
About a third of people in the United States who should be getting screening for colorectal cancer are not being screened currently, and that's an important missed opportunity.
Catherine Dolf, the JAMA Report.
Now, the task force does not have a recommendation for screening after age 85.
2 positions have been filled by the Nye County Commissioners this past Tuesday at their meeting.
The Nye County Board of Commissioners discussed and deliberated to appoint 2 new members to the Nye County Water District Governing Board for positions that are now open due to 2 terms that are expiring.
Nye County Water District Governing Board.
Mr. Chairman, I'll try again. On Area 4, Jack Freeman has a great resume as a well driller. In Area 4, Position 2. In Area 4, Position 3, Dennis Gaddy. So those are my 2 names. Is there a second?
I'll second.
Okay. I have a motion and a second. Comments from the board?
I have a question.
Go.
Can position 2 move to position 3?
I checked.
You checked?
And
good. Wonderful. That's a great solution.
Okay.
Questions? Anybody else? Comments?
This is just our statutory duty.
Yep. Again, I think that I understand we have to meet our requirements, but if there's a request to do anything with this, and I think Donna, you had a question that you wanted to put a BDR together. If you want to do that, we'll go ahead and get that started.
Yeah, well, you have 4 days.
I understand that can be tacked onto a bill instead, onto the end of a bill instead, so we don't have to do a BDR on it.
We're going to need somebody to do that. That would be.
I did send an email to Pam, and I'm waiting for an answer. She probably is working on that already.
I believe you would have to identify a legislator, Donna, and take it directly to them so it goes through the LCB.
Yeah, it just needs to go onto a bill, though it doesn't have to be a BDR.
Yeah, we just need to make sure we have somebody to sponsor it, Donna.
Okay.
All right. With that, I got a motion.
Yeah.
All right.
Okay.
Yeah.
Pam, did you have something to say?
Okay. I have a motion and a second. Call for the vote.
Aye.
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 Nay.
Nay. I did not have a chance to interview these people, and I apologize.
3-2. 3-2.
Thank you.
Without talking to them personally, one-on-one, and asking a lot of questions, I got to say no.
I know, but Commissioner Boraski, we just need. We've been informed by our DA that we still need to perform our duty, regardless if if we like the board and how it's functioning or not, but we still have to perform our duty as an elected board. It doesn't make us feel any better, believe me.
You know, folks, I'd have to say something. I'm sorry, but we have staff that is to do certain things for us, but when it comes to making legislative changes, it is up to us as commissioners to identify the legislator that is going to champion things for us. So Commissioner Cox, please, if you have something you want changed with the water district, if you want to tack it onto somebody else's bill, you need to identify whose bill you're tacking it onto and talk to that individual yourself. Having our county manager pursue something like that is not appropriate it will not be seen as appropriate by the state legislators. So identify your champion, please, and take that through them.
I will do that. Thank you.
The federal government last month recorded the biggest monthly budget deficit since February, and the deficit so far this budget year is running 10% higher than a year ago. The Treasury Department said Wednesday that the deficit came in at $112.8 billion in July, the highest since February's $192.6 billion, but down from $149.2 billion in July of 2015. For the first 10 months of the budget year, which ends October 1st, the deficit was $513.7 billion, up from $465.5 billion a year earlier. The government runs a deficit when it spends more than it collects in taxes and other revenue. So far this budget year, government revenues are flat from a year earlier, but spending is up 2%. Spending rose on interest payments and Medicaid. Revenue from corporate taxes is down 12% so far this year, reflecting a drop in business profits. The Congressional Budget Office predicts that 2016 deficit will total $590 billion, up from last year's budget gap of $439 billion, largely because of lower than expected revenues.
And News 46 will return with more news after this break.